Muskil, are you on? Okay. Hello? Hello? Okay.
Okay, so we had given 5 minutes for people to log in. I can see we are at 67 on. So I guess we probably start so I don't keep those who kept time from waiting. So first of all, I'm Dr. Dennis Miskela. I'm the Deputy SG for the Doctors Union Kmpdu, and I'll be your moderator this afternoon. As you're all aware that today's webinar is about the Kmpdu, recently launched Kmpdu policy brief, number 1, on the COVID vaccination. Yeah, and we'll have our presenter, who is Dr. Ann Baganatra. She's logged in. She's the Deputy Treasurer for the Union. So just a brief summary of the COVID situation that we have currently in the country, so that we can know why we are here today. So first of all, COVID was first detected in Kenya on the 12th of March, 2020. Of course, you're aware that it had been around longer than that before being declared a pandemic on the 11th of March. Yeah, the first reported case by WHO as a public health emergency of general concern was on the 30th of January, and a pandemic declaration on the 11th of March. In Kenya, we reported on 13th of March 2020. Yeah, and since then, up to date, we have had tests done at 3,164,789. Of all those tests, the total confirmed cases have been 319,011. We are all aware that these numbers might not be the true picture, could be higher because we have challenges around testing, and also we have challenges around people getting to get tested. The number out of this 300 and almost 20,000 tests done, we have had recoveries totaling about 287,140, and total deaths 5,520,000. And out of all these, we know that probably there are more unreported cases. We have challenges around data, health-seeking behaviors, and we still agree that the numbers could be higher. Amongst these, there have been healthcare workers who have succumbed. Sadly, I don't have the data, the updated data currently, but they are running into double figures, and that's why, as Kmpdu, we decided that it was time to rake up our advocacy, because as a union, we were more towards the labor matters. But when it comes to issues affecting our members and also affecting our clients, who are the patients, and also affecting the healthcare system, where we also treat other conditions, we felt like we needed to push for the vaccination advocacy. We know that just the world broke record just trying to get the vaccines on time. We also know that in the global south, or like this, in the poor countries, we have had challenges around getting this vaccination. In fact, today I saw a communication from the WHO Director General talking about that. While the West, we've had almost 7 times the vaccination updated 7 times more than the poor countries. And we've been trying to push about the idea about vaccine apartheid, why poor people have to suffer, or poor countries have to suffer before they get the vaccination. We know of countries that are now doing their 4th boosters, while in Kenya, the latest data is that our population fully vaccinated just at 17%. Yeah. So with that, we've been pushing for people to get vaccines, and we're glad that so far government has availed enough vaccines, because the latest numbers we have received is about 23,279,820. Yeah. Out of all these, we've only vaccinated around 4 million people. So as Kmpdu, we ask ourselves that after going throughout the stress of getting the vaccines expensively from abroad, getting them donated by our partners, and availing them locally, why are the people not going for the vaccinations? Why even healthcare workers? Because sadly, even the healthcare workers are not very, very keen to get this vaccination. Yet we know that the COVID vaccine helps in not only reducing death, but also reduces the severity of the disease. So the importance of that vaccine cannot be overstated. And that's why, as a union, we launched this summary that I want to gladly now invite Dr. Ganatra to unmute and give us the policy brief. Then after that, we're going to have a Q&A session. You can type the question, you can type the question, you can raise your hands, we just have a discussion around it. And luckily enough, this KMA webinar is probably going to have mostly healthcare workers. And so we're going to share knowledge and just learn together. So karibu Dr. Ganatra.
Hi, thank you so much, Dr. Miskela. Am I audible?
Yes, you are very audible.
All right, thank you. Thank you so much for that introduction. I'm the Deputy Treasurer of Kmpdu, and I'm very happy to be here this afternoon to discuss the policy brief that we launched in December. As he has rightly introduced, the reason why Kmpdu decided to take that, and I'm going to cover that in our first few slides, is because in as much as we're a trade union, we stand for health as a right. And so anything that constitutes health policies is something that we as a union intend to take up. And I'll be taking us through some slides and a summary of the policy that we launched in December. I have a new, let's just give me a second though. All right, so I'll just be sharing my slides. Please let me know if you can see them. Dr. Miskela?
Yes, we can see the slide. Just, yeah, okay.
Excellent.
Perfect.
So why did Kmpdu prepare this policy brief? And while we were working on COVID-19 activities as a union, when we were doing social media advocacy, when we were doing programs, we would hear from some of our doctors, why is Kmpdu involved in the COVID-19 activities? Why are we not focusing on health worker rights? Why are we not focusing on wages? And, so those were some of the common comments that I personally heard, and I think some of my team members may have also heard. So I just wanted to take us through what a trade union and what Kmpdu stands for. And this is an excerpt from our strategic plan. So you can see, yes, we're supposed to unite doctors of all cadres and qualifications in Kenya. We're supposed to provide a means for cooperation among the doctors. But the one that I want to place focus on is to actively engage all stakeholders on any policy issues touching on the delivery of healthcare services, and to promote the principles of equity, professionalism, and meritocracies. So this is why Kmpdu was actively engaged in COVID-19 advocacy, equity. We constantly are talking about vaccine equity because we stand for healthcare as a right, and we must promote equity of health. As we look at our strategic plan as Kmpdu, we have 7 pillars, and out of which one of them is lobbying, advocacy, publicity, and communication. And when we talk about lobbying and advocacy, it doesn't only mean lobbying and advocacy for healthcare workers' rights. We are meant to advocate for healthcare for all, and part of that is advocating for vaccination for all, not only COVID-19 vaccination, but all vaccines. But we focused on the COVID-19 vaccination. So the policy brief is there. And also part of our strategic plan is partnerships, collaborations, and social actions. So that is why we constantly partner with KMA, with the People's Vaccine, OSAIA, the People's Society, Inequality Now, so many of NGOs, so that we can advocate for better health for all Kenyans. So what led to this policy brief to be written? So at that point in time, between July and August, we had noticed that we were having some vaccine hesitancy, including amongst healthcare workers. So we had the vaccines, but nobody was coming up to take the vaccines. We also had issues of vaccine access at that time. So there was a lot that was going on about the vaccine. There were people who were rumbling, or rather rushing to get vaccines when they were not supposed to get vaccines, whereas others who were supposed to get vaccines were not getting the vaccines. So we thought, why not focus on working on a policy brief? And we engaged with healthcare workers, mainly clinical officers, doctors, to collect data and come up with this policy brief. So the data was collected between July 1st and August 15th last year, and we used a method of qualitative and quantitative approaches. So some of us went through interviews, long 1-hour interviews on our views of the vaccination strategies, our views on why vaccination uptake is low. It was a very conversational type of interview, and it was also anonymous. And we also had online surveys going around and desktop reviews. because there was the COVID-19 restriction at that time, we were unable to do focus group discussions. Now, after all this data was collected, we came up with a policy brief, which was launched in December 2021. And here is a picture of the policy brief launch. So who was interviewed? Like I said, we mainly focused on the healthcare workers and actors more than the rest of the population. And we're not saying that we purposely didn't. It was just the focus of our study was the healthcare workers, because we wanted to understand their views of the vaccination uptake, their views of the vaccine, why they felt that the vaccine was not being taken up. But in future, we do also probably, hopefully, will be able to do a study that involves the general population. So government and NGOs were also interviewed, and we looked at all the gender aspects to make sure that the interviewees were balanced. So what were the key findings of this policy data collection that led to the policy brief? The first is that the overall performance, when we look at it, there were 5 things that we focused on. So the access, the stakeholder engagement, the vaccine resource use, public communication and access to information, and vaccine group priorities. The interviewees were asked these questions, and what we found was that access was a problem at that particular point in time. There was inequity in access, and we do know that at that point in time there were people who were getting vaccines even when they were not meant to, they were not part of the priority populations. In terms of stakeholder engagements, and we will break this down into more details, stakeholder engagements was very little, and the majority of the respondents felt that the Ministry of Health took a very top-down approach in rolling out the vaccine. So it was more of this is how we're doing it, and no bottom-up approach. Like the communities were not involved. The sub-county medical officers of health. It was more like, okay, this is how we're going to roll it out, and this is how you have to do it. And majority of the healthcare workers felt that way. That's 85% of the respondents. Then the vaccine resource use, majority of people felt, and that's very a high 97.4%, that the vaccine resources were misused. And that tells us a lot about how we need to really talk about accountability, transparency in resource use in the healthcare sector, because it affects a lot of things in the long run. Then we had a 50% view on the communication and on the public communication and access to information. So that was sort of 50-50, like people felt that there was enough information and some people felt there was not enough information. And there was a lot of myths and misconceptions also going around. Now, the part that most of the healthcare workers felt that the government did really well, the Ministry of Health did really well, was in the vaccination group priority. So they prioritized the groups really well. So at that point in time, we had the elderly, those with comorbidities, and healthcare workers, and then those in the service industry getting a priority for vaccination. And majority of us felt that was well done. And given that the vaccines available were not enough, so the prioritization was very well done and well thought out. And that was 82.1% of us felt that way. So now let's look at the perceptions of the vaccine itself. 75% of the respondents, and this is very interesting, and we really need to look into this. Everyone was a healthcare worker, but 75% of the healthcare workers who were interviewed for this policy had a negative perception of the vaccine. So what does that tell us? Even as we increase access, even as we increase the availability of these vaccines, we really need to work on improving the perception of the vaccine amongst healthcare workers and the general public. So what was it that they felt about this vaccine? And some of the things were that it was just a general fear of the unknown. Why was the vaccine developed so fast? And some very important questions, like why don't we have a vaccine? Okay, now we have a vaccine for malaria, but why did it take so long? And why don't we have vaccines for other diseases? And why is it that we're giving COVID-19 so much importance? That all led to a lot of concern about this vaccine. Then there was also the idea that the disease was created in a lab, it's a Western disease, it doesn't affect us. So these answers were coming from healthcare workers, but probably also it was their view of what people felt around them, not necessarily their own views. And then there was also myths about the global South domination. So this vaccine could be a means of dominating the global South, but that was we had a question that, okay, then why are the Western countries taking it up at 100%? I mean, their uptake is so high. So those were things that were going, those were the questions that were going back and forth. And as we can see, all this perception of the vaccine was propelled by the lack of access to correct information. So there was only 50% of people who felt there was enough information. So this all was being further propagated by that. Now we come to the key findings regarding the vaccination rollout plan. So we've looked at the overall vaccination rollout process, what people felt, no, the vaccination process, sorry, the negative perception of the vaccine, what people felt about the vaccine, and the vaccination plan. So the effectiveness of the vaccination plan was undermined by exclusion of key stakeholders. So unions felt like they were not involved, healthcare workers felt they were not involved. The majority of people felt that it was just a purely top-down approach. So we would get information from the Ministry of Health that this is the way we're going to vaccinate, this is how we're going to do it, and this is the budget, and that's all. So 85% of healthcare workers cited the lack of involvement in the process, and that could have led to the lack of ownership in the process of the vaccination, and hence low uptake and vaccine hesitancy. Then we look at the supply chain challenges and inequitable access undermining the national vaccination plan. So at that point in time, especially in that period, June to August, there were some of us who are due for our second dose. And when we would show up, the second dose was not available. We were getting messages that were telling us that come to get your vaccine. And then when you show up, the vaccine is not there. So there was access issues at that point in time. Also, the reason why there was other issue, no, sorry about that. Also, 89.7 respondents felt that the government failed in providing equitable access. So majority of the healthcare workers felt that the vaccine was mainly available to few areas, not in the rural areas, not in it was not an all-round access, but there were some of the reasons they cited is that there were few vaccination centers already before COVID started. So this could have led to the inequitable access, because in counties that had more dispensaries, more clinics, more health centers, the vaccination access was better than the areas where they have fewer dispensaries, fewer health centers. So it's not necessarily that the government did not have the vaccine for that area, it's just that there was no vaccine centers in those areas. And the main thing was that there was a lack of engagement with communities. So that was what we took up as the Kmpdu. We tried to involve the community health volunteers. So there was a lack of engagement with communities, and that led to issues with the vaccine uptake. And then finally, a lot of healthcare workers, which I already said in the first slide, is that 97.4% of healthcare workers raised concerns that there was issues with efficiency, accountability in the use of COVID-19 finance resources. And a lot of us felt that there was a lot of money being pumped into COVID-19, but we were not able to see the fruits of it at the grassroots. And this also now affects vaccine uptake, because it all channels the myths and misconceptions surrounding the vaccine uptake. That why is the money being channeled elsewhere? Okay, why are we now being forced to take the vaccine? So it all of these issues, it's all a multi-pronged problem that leads to vaccine uptake being low. So the other thing that we realized was the COVID-19 millionaire reports fueled myths against the vaccine, and therefore also led to vaccine hesitancy. So the issue of corruption, mistrust of governments means it affects a lot of other policy uptakes, because if we are not transparent, people will not trust us. And then finally, majority of the people were dissatisfied with the response to the pandemic and the vaccine rollout. So in general, we felt that the pandemic was not well handled and the vaccine rollout was not done well. So they felt that we were spending a lot of resources in terms of communicating about the number of cases daily, but we were not spending more on education at the grassroots. We were not spending more on involvement, stakeholder involvement. So those were some of the things. And 73% were dissatisfied or very dissatisfied with the way the government responded to the pandemic and the vaccine rollout. And that's the finding. So very few people were satisfied, only about 2.5%. So that says a lot about what we found amongst healthcare workers. If we do this in the general population, we may get different findings. So that's something. So what were the recommendations from the in conclusion from the policy? So we had four, we broke it down into four. So we had recommendations to the government, the healthcare workers, to the media and the civil society. So to the national government, we're urging them to come up with a national policy guideline for the COVID-19 vaccine and immunization in general. Immunization is a primary healthcare activity, and we may face new pandemics in future. So we really need to have strong guidelines that will integrate vaccination into them rather than having different vaccination task forces and etc. And we need to have a national vaccination process that enables the private healthcare facilities as well to provide the vaccination services. That was our recommendation. And it's currently ongoing in terms of the KEPI, the Kenya Expanded Immunization Program for Immunization. We do have both facilities provided. And right now, COVID-19 is being provided, vaccine is being provided by private healthcare facilities. But at that point in time, there was the debate that should we allow it or should we not allow it? So that was in response to that. Then we need to empower the Pharmacy and Poisons Board to accelerate COVID-19 vaccines approval. And we needed to make the vaccines available and ensure effective and equitable implementation of vaccination across the country. That's very important. So that can only happen if all the counties are well-equipped, well-structured, well-designed, have a very strong primary healthcare system, because supply chain challenges were in place in some areas which did not, for example, have good storage facilities at the sub-national level. So those are our recommendations to the government. We also wanted them to put in measures to ensure that any funding that they use, there's transparency and accountability, because clearly when there's lack of transparency, when there's lack of accountability, it really fuels a lot of myths and misconceptions, because we hear of rumors that, okay, COVID is now just a money-making business, it's a money-making disease, and that affects COVID-19 vaccination uptake and also the belief in the disease itself. We also want to advocate, and we also are asking the government to increase resources for health, which is what we keep advocating for, allocate sufficient resources to support healthcare workers at all levels and encourage all healthcare workers to be fully vaccinated. So this was one recommendation to the government. And specifically when we talk about sufficient resources and healthcare workers, while the COVID-19 vaccination rollout is happening and we still have it going on, we know that we don't have an increase in the healthcare workers. So we have a new program ongoing. We have a vaccination, a rapid result initiative going on, but the number of healthcare workers who are working on this is the same who were supposed to be working prior to the pandemic. So there's a sort of push and pull, and the healthcare workers are being taken from different areas to come and do the rapid result immunization activity. And it is affecting other areas of health. So we're really urging the government to allocate sufficient resources and support healthcare workers, and also increase the number of healthcare workers. We want to deploy more effective public communication strategies, including generating popular IEC materials that simplify complex vaccine information for the non-medical public. So that's a recommendation, and it's highly needed. We have the radio presentation that goes on daily that tells us about COVID-19, but we need to now talk about the vaccine. At that point in time, there was not much information about taking up the vaccine. Now, for healthcare workers, we healthcare workers need to advocate for sufficient number of vaccine doses in the country, and we need to participate in the planning. And also as unions, we need to use our power, our legitimacy, and our platforms to advance public knowledge in vaccines and address the fears and misinformation. And that is what we're trying to do by doing all our outreaches, by using our social media, because that in one way helps us to achieve healthcare for all. And sorry, there was one more for this media. Yes. So for the media, we really need to have the mainstream media, and particularly to provide empirical data to educate the population, to combat myths and correct misinformation about the vaccines in the local language, in whatever way it's possible. And even as concerns of a vaccine hesitancy remain across the world, we need to make sure that the media collaborates with the government so that we mitigate this and we improve the trust of the vaccine. So media is very key in this. The media was very key in the initial stages of the COVID-19 pandemic. We had the daily reports and we still continue. So we really need to use that channel to talk about the vaccine, to reduce the vaccine hesitancy. For civil society, this is including campaigners for health and rights. We need to ensure that we advocate for equitable access to vaccines, and that we need to keep doing that, because we saw the troubles that we had in getting vaccines in the beginning. We had Twitter handles, we had, the global South is dependent on the West is giving vaccinations to non-priority populations, whilst we still haven't even vaccinated our priority population. So that is where the civil society comes in to advocate for equity and for a more just society, and also to fight for transparent and accountable use of resources. We have the voice to do that, because if we don't, the resources will be misused. They may not be misused, but there may be no transparency, and the public will continue to remain with a lot of disturbance that where is this money going, and what is this disease really about? And that's also where are we today. Dr. Miskela already covered this. So we have received about 23 million vaccines, and we have vaccinated fully about 5 million. I'm just rounding it off. But given the findings of our data that we collected, do we think that we will be able to increase the vaccine uptake? We may get 100%. We may get 100 vaccines available for 100% of our population, but will we reach a point where, for example, countries were just throwing vaccines because nobody was taking them up, or returning them to the sender? So my question to everyone is, after the findings, do we really think that even if we had all the vaccines today, would we be able to vaccinate everyone? Would people take it up? Do we have the infrastructure to provide all the vaccines in that short period of a time? So that's all for me today. Thank you very much, and I'll be open to questions. And
thank you so much. Thank you so much, Dr. Ganatra, for that awesome presentation. For sure, I can vouch that from the side of the union, we have been able to do our part, and we have to appreciate the efforts of the government, because you've seen that the latest developments, because of the advocacy that both state and non-state actors have been pushing for, the numbers for the people getting vaccinated is quite high. We have seen that right now. Kenya already began the booster giving out boosters. As of today, almost 100,000 people have received their booster doses. We also notice that we also are now really actively pushing for pregnant women to get vaccinated, which is something very, very good. We are now even encouraging the teens also to get vaccinated. I saw in news the other day that even Angola was now even compulsory school children getting vaccinated. And so it's for sure that the only way we are going to beat this disease is by vaccination. And I'm sure that even amongst ourselves that who are not being vaccinated, and as healthcare workers, it's really sad that we prescribe something, a medicine that ourselves are not taken part of it. So please, let's go out there. Let's encourage people to get vaccinated. Yes, I know sometimes the public says that, oh, even those get vaccinated are falling sick. Yes, nobody says that getting vaccinated is stopping from getting sick, but the severity of the disease is reduced, and even death is reduced in a setup like ours where we have limited ICU bed, limited human resources to treat the severely sick, limited oxygen points. We are better off with the vaccination. We need that vaccination more than even the West that are getting it. So please, the key thing I want us when we leave this webinar is that let us all become advocates for vaccination. In your Facebook timelines, everywhere. I know sometimes you always encounter a few skeptics, but please, let our voices outnumber their voices. Yeah, so that we can get as many people as possible. I'm seeing yes, I'm seeing Dr. Wasabi is appreciating the present. Yes. So with that, as we wait for the any other question popping up, I want to really thank our partners. OSEA, the Open Society for East Africa, really came through for us in this project. They were able to avail for us the funds to help the research. I'm seeing Dr. John asking that, are there strategies for vaccinating 15-year-olds in schools, school-based programs? Yes. Dr. John Masasabi, yes, there are programs. As I said, that there was a communication that was given out by the ministry early December about the vaccination of children, and it was a Pfizer vaccine is what was supposed to be used for this vaccination. And as of now, I know young people have received the vaccine. So yeah, there is that program, and it is now for us now as healthcare workers to push for that. Of course, we have to also call out government for a few things. That government began this journey, as Dr. Ganatra ably put it, that they began this journey without involving the stakeholders. We just saw that the vaccines are available, go get. Yeah, and maybe because of that lack of stakeholder involvement, we didn't get it right. But right now we are on the right path. I'm actively aware that government is about to launch a national advocacy program and rollout program campaign for the vaccines. So we'll wait and see how it happens. I hope that they'll be able to include all stakeholders in the program, and we get our people vaccinated to return life back to normalcy, or at least the new normal. Yeah, I'll give it like maybe another 2 or 3 minutes. We see if there's another chat coming up, then Dr. Ganatra will respond to them. If not, within 2 or 3 minutes, I'll then call the webinar to closure. So yeah, 2 or 3 minutes, we see what happens out of it. Yeah, and as we wait, I'll just say that yes, as I have to thank Keme for organizing this webinar. It was a very, very timely webinar, and I have really thanked the president of Keme, Dr. Weronyino, for finding this well-oiled working relationship between the association and the union. We have been able to achieve so much by this collaborative efforts, and I hope that even the other unions, the clinical officers, the nurses, or the lab techs, and every other healthcare worker, sooner or later we'll all work together. Yes, I can see Austin, you see. Yeah, I'm seeing Sister Paul in Congo saying that how can we intervene for people fully vaccinated to travel without interruption of testing positive? So Ganata, do you want to take that? Sister Paul in Congo's question?
I think you can go ahead.
Yeah, so Paul is asking how can we intervene for people to be who are fully vaccinated to travel without interruption of testing positive? Yeah, I agree with you. I truly agree with you, Sister Pauline, that right now COVID is in the communities. Yeah, we saw even when the Omicron variant came about and every country was shutting down, but they don't help, because even UK shut down. Right now, almost the entire population got Omicron. Yeah, so sometimes I feel like stopping people from traveling because of COVID is like having mopping a floor with the tap running. Yeah, the key thing is that everybody in this country, the West, the South, the East, must all come together to ensure that everybody gets vaccinated. Whereas almost 70% of the adult population. That's the only way we're going to change things. Otherwise, I think testing probably has been bypassed by events. That's my personal opinion as a unionist and a human rights defender who believes in rights to move across borders. But we continue championing for the advocate for the vaccination. That's the only way that we can then show the proponents for the testing that as when people get vaccinated, then there's no need for all that kind of testing. Otherwise, yeah. Any other question?
I've seen a question in the chat about from Austin. He says, will the rollout will increase and help increase protection against COVID-19? Do we have a mechanism for monitoring any adverse effects? Yes, we always have, whenever there's a vaccination that is provided, be it COVID-19, polio vaccine, we have a reporting tool and reporting mechanism for adverse effects. And this is carried out at the level of the vaccine provision. We also have a disease surveillance reporting tool that actually notes down any adverse events, and it is reported to the main headquarters. And yeah, so for all vaccines have a reporting tool for adverse effects. Do we have any data from prisons and mental facilities? So that's an excellent question. We possibly, there was a lot of data collected about COVID-19, and we had a lot of research, but we personally don't have any data on prisons and mental facilities. Our data was only collected amongst healthcare workers working in different areas in Kenya. However, this is something that we should look into. Yeah.
And just to add something around the data, yes, we probably don't have that data on those two, but the latest data that we have is that on healthcare workers, government targeted 208,418 people to get vaccinated, and vaccinated almost 230,000, almost a 100% achievement. Then the security officers were vaccinated almost 206,000. Teachers were at 81% vaccination. People above 58 years are at 33%. That's a really critical area to get to work on. So, and others are around 3 million. So the data, one thing that we have come to learn through this COVID vaccine, that we must be able as a people, especially people in healthcare, to manage our data. We really struggled with getting local generated data most of the times, and even during the Delta variant outbreak, we had about late deaths and all that. So those are things can work around our reporting mechanisms for healthcare. So there being no other, and yes, look again, there being no other question at time, being meant to leave here at 2:45. So I want to deeply thank you, the attendees of this webinar, for creating time to come. And we hope that as we roll out other programs, you will be supportive, not just of the association, but also for the union. And may we go out there and be champions for the vaccine. Above all, we want to also condole with our patients, our colleagues who have died out of this, pandemic. We hope that in the fullness of time, they'll be able to be able to beat this. Thank you so much, and you can now log out at your own. I'm just seeing there any other chat. Yeah, you can now log out at your own pleasure. Asante sana, Mungu awabariki, kuwe na jioni njema.